Hi, I'm Dr. Kim Butterwick, and today we're doing PRP, platelet-rich plasma injections into the scalp for hair growth. This is a treatment that we've used. It's been around a while, but there wasn't enough proof. So now there's enough proof that with a series of 3 to 4 injections, we're going to be able to grow about 30% more hair. And then we'll maintain it with injections every so often, 6 months to a year. So you can see here our patient has very thin skin, and sadly this happens to not just men but women too, and she just is super thin there. This runs in the family. It's called androgenic alopecia, and she's also going to be on other medical treatments, but it's just not enough. And it's too hard to use creams regularly. It's such a mess. So PRP is an exciting new use. And if you can get 30% more hair, that's fabulous.